Welcome back to the Now Morning Show. Of course, we're keeping our focus on Tobago because it's Tobago Thursday. And so when we use medications designed to kill microorganisms, inevitably, a small percentage of those organisms survive. Now, these surviving organisms have inherent resistance to the treatment. And so this morning, we're going to be discussing the organisms and those parasites that do not resist the treatment. And joining us to talk more about it is the president of the TNT Veterinary Services and founder of the Tobago Animal Hospital, Dr. Paul Crooks. Dr. Crooks, good morning. Thank you so much for joining us on Now.
Good morning. Thank you for having me.
Now, Dr. Crooks, before we get into the conversation, because I know that we want to focus on sheep and goats, but let's go back a bit. Exactly what is a parasite, especially as it relates to animals?
A parasite is an individual of one species that uses an individual of another species for the completion of its life cycle, and by doing that, it damages that other species. So some people would compare children to parasites. Children, by definition, cannot be parasites because they are of the same species as the human parent.
Right.
So we are talking about animals like ticks. We're talking about worms or helminths, which are found in the intestine usually. We are talking about screwworm flies. Sometimes if a dog has a cut and the cut is left untreated, flies will come and lay their eggs, and there may be maggots. So those are some examples of parasites.
Yeah. Can the parasite, especially the ones that attach to the animals, can they be transferred to humans as well? So, for example, if you have your dogs living with you and you have your animals inside, can they also, transfer to your skin, to your hair, and different parts of the body?
Depending on the parasites, that's an almost certain scenario to come about. It depends on the parasites. So there are some worms that may affect dogs that could also affect humans. So there are some species of ticks that may affect dogs that may also bite humans.
Yeah.
But that is not, thankfully, a very common occurrence. And more importantly, we do have a number of medications that we recommend for routine use in pets that should almost eliminate the risk. I guess there is always a risk, but it would be basically zero risk once you're using the appropriate medications in dogs.
Yeah. Well, let's focus on sheep and goats, Dr. Crooks, as it relates to that in particular. Tell us what sort of parasites we would see in these animals in particular, and how can we get rid of it?
I lost your audio for a bit, but I can say that as far as sheep and goats, we do have primarily intestinal worms that we're dealing with. And in Tobago in particular, the sheep and goat industry is a massive one. By far, when comparing the size of the populations, it's a by far bigger sector than the Trinidadian sheep and goat industry. And what we're seeing with sheep and goats is an increasing level of parasite resistance. So we're dealing with primarily intestinal worms, stomach worms, and the medications that are commonly used by farmers and by vets are becoming less and less effective over time.
Wow. So then how is it a losing battle? Because we have this medication that we're trying to use to get rid of the parasites, but then we're saying that over time, the parasites' resistance is actually growing, and so they are no longer responding to that sort of medication. And so what do farmers do? What do owners of livestock do to sort of combat the sort of parasites that they're seeing in their livestock?
I'm going to be very blunt. The outlook isn't great, not only for this particular issue of parasite resistance in sheep and goats, but also for antimicrobial resistance, even in human medicine, where you may go to have a surgery performed, you may pick up a little infection after surgery, but at the hospital where antimicrobials are used broadly, certain cleaning agents are used in the environment, the only bacteria that survive, the only bacteria that can infect you in such an environment are bacteria that are unlikely to be treated by the common antibacterials that are used. And so now you've had a surgery, everything went well, you get a little infection, and now that infection has made you very, very sick. The outlook isn't great. I know right now there are artificial intelligence programs that are being used and employed to try to come up with new compounds that would be both safe and effective for killing bacteria and parasites. But we are still at that stage where we are looking for new medications that we can use. So as it stands, in sheep and goats, we have had farmers who their sheep have had worms that are resistant to all the dewormers that we could find on the market. So we've been using dewormer after dewormer after dewormer, combination strategies, trying to deal with individual animals that show signs of illness versus dealing with the entire flock. And in such scenarios, unfortunately, the dewormers aren't working. Yeah. So in those instances, we recommend to farmers a number of different treatments, recommendations. They have to isolate and remove animals. If they have certain sheep that constantly get sick from worms, get them out of the breeding stock. You may need to change a majority of your reproducing mothers. We're looking at a number of different strategies altogether to try to reduce the negative effects of worms, but in general, it's a battle that we're losing. So we recommend to farmers now, please do not blanket deworm your animals. Do not just give everybody, because the standard practice was once a month, you just hit them all some hunter or whatever dewormer you can find. If we continue to do that, we are creating scenarios where more and more resistance will be seen and unfortunately negatively impact our farming industry.
Well, Dr. Crooks, I'm thinking about the farming industry, but I'm also thinking about the people who buy, let's say, for example, goat. So this is a two-part question. What are the symptoms if one of your animals are sick? So, for example, is it that they're going to be vomiting, for example, or how can a farmer tell when their livestock is sick? That's the first question. And then secondly, how can the public be assured that the farmers aren't using these ill goats or even sheep and putting it on the market for people to purchase?
Okay, so I'll start with the second part first, which is how can persons be assured that their meat is safe? For the most part, we have a very thorough public health support system that inspects animals at the time of slaughter. Therefore, any disease or parasite that could be transmitted from animal to human, a zoonotic disease, sometimes even through the ingestion of food, in those cases, you're safe. You don't have to worry about eating an animal and the animal causing problems. Plus, we also cook our meat here really well. If it's one thing in the Caribbean, we like our meat well cooked. So the risk is extremely minimal. That said, I don't want to say there is no risk. There is a risk, and there is a backyard slaughtering practice that's still very common, and those animals will always slip through the cracks. There's no way, no getting around it. There's no public health inspector examining animals that are slaughtered on the side of the road or in somebody's backyard. And whatever meat you buy there, you buy at your own risk. That's the first thing. The second thing is generally parasites in sheep and goats don't affect humans at all. Thankfully, not the ones we have here in Trinidad and Tobago. And therefore, the impacts of resistant parasites are limited to the livestock sector. And what we see when sheep and goats are overrun by parasites, if you pull back your eyelid, in primary school, people used to pull down their eyelid and reveal the pink part and just have it exposed. Your eyelid should be nice and pink. Sheep and goat should be nice and pink or red. When you pull back the eyelid, if it's pale pink or white, that means the animal is losing blood or has lost blood. And usually that's because of a very, very bad parasite called Haemonchus contortus that is very common here. And that can cause death in as little as 2 or 3 days, in a goat especially. But then you have other signs of parasites, internal parasites, including diarrhea, weight loss, change in hair coats. Sometimes they have a swelling under the chin called bottle jaw. Sometimes, especially in kids or lambs, the belly will look very large, like a pot-bellied animal.
Yeah.
Those are the signs of parasites that we look for.
Yeah. As it relates to the worms, Dr. Crooks, you mentioned that, the farmers are using different sorts of dewormers in order to rid their livestock, the sheep and the goats, of the parasites. Have we partnered with anybody, let's say regionally or internationally, to import some sort of new medication that might be able to combat these parasites?
Unfortunately, drug companies are actively researching all of the time, but right now there is no new drug for parasites in sheep and goats. There hasn't been one for a long time. And when I say new drugs, I mean new classes of drugs, because I explain to farmers like this. Drugs typically have a last name, like amoxicillin, penicillin. Those psyllin drugs are in the same class of antimicrobial. And if you use amoxicillin to try to treat an infection and it doesn't work, chances are, not always, but chances are the penicillin also wouldn't work. We have a lot of drugs that are actually in the same class, have the same last name, and therefore they all act in the same way. And if the worms are resistant to one drug in a class, they are often resistant to the other drugs in the class as well. So what we need is new classes entirely, and drug companies are researching that, but it's a global problem.
It's a global problem. And Dr. Crooks, are we seeing the parasites in the sheep and goats in Tobago more than Trinidad? And if we are, what is the reason for that?
That data is hard to say for sure. I know anecdotally, we see more than 50% of our sheep and goats here in Tobago probably have resistant parasites. The reason is the practice of so-called routine deworming. I look at it like this. If you have 10 people in a party and they all drink the same amount of alcohol, 2 glasses of, I don't know, 2 glasses of a beer or something, they all react differently. The person who drinks 2 shots and acts like nothing has happened, that person is resistant to alcohol. The person who drinks 2 shots and falls asleep, that person is susceptible. And if you imagine there's some overwhelming being over all of us who pours alcohol on the world every month, those people who are more resistant to the alcohol because the environment keeps changing, the others who are susceptible, those may die off because they're getting this very, very high dose of alcohol that they are more susceptible to for whatever reason. Enzymes, they absorb more through their skin, whatever is the situation. And therefore, the resistant persons who only, when they drink 2 shots, nothing happens, those persons are the only people who can reproduce. So we apply a selection pressure. Here in Tobago, the practice has been that farmers would just deworm their animals just because it's every month. We'll just buy some dewormer and give. Over time, they apply the selection pressure by changing the environment in the sheep. They apply the selection pressure where only resistant worms can survive and thrive. And therefore, those resistant worms keep multiplying and multiplying and multiplying and eventually become dominant. And that's where we are now in Tobago. And so the situation is we're trying to discourage that so-called routine deworming. We are asking that persons have a vet come by, examine the animals, and recommend how you should deworm, how you should assess animals, and how you choose where you apply your dewormers.
Yeah. Now, Dr. Crooks, we have about 1 more minute again, and I know that you mentioned earlier that this situation looks bleak, but any words of advice for farmers at this point in time who are seeing the parasites in their sheep and goats?
Call your vet office, call your local vet, call your county vet. Here in Tobago, the vet diagnostic lab is 660-2008. In Trinidad, you can call the Ministry of Food Production and you'll be able to at least chat with a vet. You should have a vet come by and assess the animals before applying any dewormer. That's the best advice. And once you go that route, you should hopefully see things slowly get back to normal.
Yeah. Dr. Crooks, always a pleasure to have you here on the show. I hope that the farmers and those who are listening heed your advice. So thank you so much for joining us this morning.
Thank you very much for having me again.
Of course. And that was Dr. Paul Crooks, president of the TNT Veterinary Association and founder of the Tobago Animal Hospital, just sharing some tips on how you can prevent those parasites in your sheep and goats. You're on the Now Morning Show. We're going to take a break and be right back. Stay with us.